chiropractor.
That's right. There's a reason why you
That's
got the
one.
name that you do.
That's right.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 11.
Maybe I shouldn't be here. I'm caught.
Thank you all for coming. My name is Kayla Manning. The Bureau of Labor and Statistics in 2014 reported 45,200 chiropractors in the United States. If any one of you have had similar experiences to me with chronic migraines or back pain, you may have had the pleasant experience of spending some time with one of these professionals. According to the Merriam-Webster Dictionary, the simple definition of chiropractic is a method of treating people who are sick or in pain by pushing and moving bones and joints. My goal today is to tell all of you some of the different types of chiropractic treatment, some of the benefits, as well as some of the potential complications. What do you think of when someone brings up a chiropractor? If you're like me and many other people, you probably think of someone laying on a table having their bones and their joints cracked in all sorts of directions. That type of adjustment is still alive and well in the chiropractic world, but Roderick Rochester wrote an article that was published in the Journal of Canadian Chiropractic Association discussing that there are many specialties in the chiropractic world, such as orthospinology. Standard manipulation is the commonly used term for the stereotypical chiropractic adjustment, which is pushing on the joints, twisting the joints, applying pressure in various places. Orthospinology uses a handheld instrument to apply carefully calculated force and pressure in quick, repetitive sessions to various spots on the body. Because most of these, because both of these processes can be done to various joints and places on the body, the list of research benefits is very long. In a study done by Simon Dejanay that was published in the BMC Health Services Research Journal, the most common cause for seeking chiropractic treatment is low back pain, followed by neck pain. The health benefits have been studied to be only one part of the whole picture. Craniocervical treatments are done to the upper spine area and are used in patients that are experiencing headaches, chronic neck pain, and stiffness, whereas lumbar adjustments are done to the lower spine and are used in patients that are experiencing difficulties with the digestive system, urinary health, or posture. This X-ray series provided by Wellness Way Chiropractic shows an excellent progression between a patient's before and after chiropractic therapy. The patient shown is a 35-year-old woman who experienced minor whiplash. Several years later, she started experiencing chronic migraines and neck pain. The first image was an X-ray done prior to any sort of chiropractic treatment. The blue line is representative of the curvature of her neck, whereas the yellow line is the ideal curvature of the neck. 24 treatments later, done over approximately 2.5 months, the X-ray was repeated, and as you can see, the curvature of her neck is much closer to the ideal. Her symptoms were said to be 97% resolved. She had no further stiffness and no further migraines. In the same study that I mentioned prior, that was posted in the BMC Medical History Research, the overall cost of a chiropractic care regimen is much less significant than standard treatments. This is due in part to the fact that a chiropractor uses X-rays versus MRI to perform a diagnosis. Typically, the patient is not placed on any sort of prescription medication regimen, and the treatment cost itself is much less significant than in a standard doctor's office or a hospital. With all good medical treatments, there are some risk of complications. H. Charles Woodfield wrote an article that was published in the Journal of Canadian Chiropractic Association that reported, although there is continuous research being done, the overall reporting of adverse effects was relatively minor. The patients that did experience and report negative side effects only reported instances lasting less than 24 hours. Most of these symptoms included minor increases in baseline pain, slight pain at treatment site, and in some rare cases, numbness, tingling, or fatigue after treatment. Although minor adverse events are reported, major adverse events are very, very, very underdocumented. Dr. Simon Dejanay, in his article in the Journal of the Canadian Chiropractic Association, states that many people are unaware of the possibility of potential harms, one of which being vertebral artery dissection leading to stroke, paralysis, or in some cases death. This is not a side effect that has any documented instances of, but the thought of that itself and knowing that similar and serious side effects can happen can be a deterrent to a lot of people to the idea of chiropractic itself. Nicholas Kustanov reported another serious side effect in his article in Surgical Neurology International of one well-documented case of a spinal fluid leak after a patient received a spinal adjustment. All of these things can sound scary. Good, bad, or strange, a chiropractor is not your average doctor. Hopefully, learning about the types of treatment, some benefits, and potential complications can help make everyone sure that chiropractic treatment is right for them. Having my sanity saved by a chiropractor made me interested to know what it was that he did itself. I hope that I was able to share some of my knowledge with you all, and please don't hesitate to ask any questions that you may have. What is your question?
How many years of education are required to be a chiropractor?
That can vary based on the student itself and the speed of class accomplishment